international conference where we invited some of the folks that were at that conference, and others like Dan Hawkins from the States and others who we developed memberships with to come to that conference to play a major role and talk about what they do so we could learn. And that conference actually galvanized us to commit to, depending on where you live, getting up at 6 in the morning on Monday to have an international teleconference. We got them to shift it to 7, but that was okay. And the International Federation of Community Health Centers has taken root. Through these conference calls, we've been able to develop a constitution. We have a memorandum of understanding. We have a website, and we're getting started. The purpose of this and the timing for this presentation is to actually talk about the launch that is now happening internationally. So Dan, I think in August, you started this at the national conference that you had in the States. And Dan will tell you a little bit about that after I'm done. And then there was a conference in Istanbul, which was the European Federation of Community Health Centers, where they made an announcement. And now this is us. And next spring, there will be another launch in Australia. So it's amazing. And at those conferences, videos were taken, and we will actually show you a couple of them in a couple of minutes. But this is taking hold, and when we've had the conversation this morning about who are we, who do we serve, what is it that actually holds us together, it really is about what we believe in and what we think matters. And there's different language to describe the same thing, and that's okay. Whether it's people-centered care or community development, it's about how we actually deliver the services that we do, how we develop them, who we talk to, and why we're all here. Some of us have been here for a short period of time, and some of us have been here for longer. And why? So that's the interesting thing about being part of the International Federation of Community Health Centers is whether you know it or not, if you're a member of CATCH, you're also a member of the International Federation. So that's all I'm going to say. I guess in closing about this, I just want to say that really there's no manual for this. There's no bricks and mortar, but there is a vision.
And when we were contacted in, when was it, Scott? 08, 09, Adriana, about doing a international conference in Toronto, which we did 2 years ago. I was excited, committed us to do it, and off we went. That was a good start. This next step is an even stronger advance forward. And we were thrilled to have Jane Maloney and Scott Wolf join us at our annual conference in Chicago last month to announce the launch of the International Federation as something that I said to the folks at the table, get this, where's Michael Rackless? We're going global, Mike. Because it's an idea whose roots are found in communities and in nations across the globe. For example, the US model of community health centers was not found in the US. Jack Geiger, who Jane and Scott had the pleasure of meeting personally, and who we consider as one of our founding fathers back in the 1960s of the American modern community health center movement, got that model from working with two British public health professionals, I bet you remember the names, Sidney and Emily Clark, who went to South Africa, apartheid, not Nelson Mandela's South Africa, apartheid South Africa, to the homelands. We Americans gave them a fancier name. We call them reservations. And we gave them the crappiest land and said, go live on it, and you're sovereigns. You can run your own countries. That's what South African whites did to the 23 million South African natives. And what they did, among other things, with the help of the Karks, who were the godparents of community-oriented primary care, was they set up community clinics that were of the people, by the people, for the people, the model that we have, community-owned and operated. And he saw that model and he said, God, we have nothing like that in the United States. We should have something. And he came back and started the model that today supports the work of over 1,300 organizations who run 9,000 community health care sites providing care to 22 million people in the U.S.